There was tough viewing last night on ITV. The latest drama from ITV, Breathtaking, hit our screen, starring Joanne Froggatt. It's an incredible story. It's a real-life story of NHS staff who are battling to save patients during the early days of the COVID outbreak, when it was pure chaos out there.
In just a moment, we'll be speaking to two of the series' medical advisors, Dr. Tom Petty and Dr. Andrew Sinamond. But before we do, let's take a quick look at the show.
Morning. Just had a call from LAS. Might be the first one.
I'm not going to make it home this weekend, sorry. It's madness. There's currently no PPE at all.
We're overwhelmed. The virus is always going to be ahead.
Trust the guidelines.
This is insane.
Owen, where's the defib? Where's the cross trolley?
The public can be assured that we have a clear plan.
There's no plan.
Members of our team are wearing bin bags and going home wondering if they're going to die in the night.
Don't go there.
We're already there. You know this thing is spreading. They just keep coming. But no one is giving up. Prepare for the worst, but hope for the best.
Yeah, very moving watch, and you can see it tonight again at 9 p.m. on ITV and ITVX. Now, two people who know firsthand the impact of what we saw last night are Doctors Tom Petty and Dr. Andrew Sinamond. Welcome to the sofa. Great to have you in. Wow, to relive, I'm sure for you, those traumatic days, hours, months, weeks was really horrific at times. Just tell people at home who watched last night, how real was that?
Well, I think what we strived to do with the programme was to try and make it as authentic as possible. And Rachel Clark, who wrote the book Breathtaking and then was a co-writer on the scripts, her sort of overarching rule was to make everything as representative of that early pandemic, so that we were reflecting people's experiences both in the NHS and at home as accurately as possible to do it justice, really.
OK, Andrew, Tom, can you just give us a little bit about your backgrounds and why that you were asked to be involved in this?
Yeah, so I sort of went to Sheffield Medical School for 6 years, and then I worked... Interestingly, I was one of the class of the COVID pandemic in 2020, so I was sort of finishing up medical school, and then things started to happen. You know, the press conferences started, and I was like, not sure what's going to happen. It was scary enough to be a doctor, never mind seeing a pandemic unfolding and thinking, oh my goodness, this is going to be me.
Right at the beginning of your career?
Right at the beginning of my career, and it was scary enough, as I say, becoming a doctor, never mind with all this. So we were sort of sent home at finishing medical school early and was told we might be brought back in to help in whatever way we could. So I started then in sort of April time 2020 working on the COVID wards over in Sheffield and in Doncaster Hospital. In terms of getting involved in the show, I currently work at the Ulster Hospital in Belfast. I have a lot of my colleagues who are currently watching, so hello to them, Ward 3E at the Ulster. So I had a friend of mine, a colleague of mine who knew Dr. Rachel Clark and worked with her in London, and had said there was going to be a new drama filmed over in Belfast in Jordanstown, and asked if I could get involved, and I couldn't wait to jump at the opportunity. So it kind of just fell on my plate a little bit, but it's been great.
What was most striking about last night was the pure chaos of it all. Nobody really knew what to do. There was direction coming from on high from the government. It didn't seem to fit in what was actually happening at the coalface as such, Tom. But nobody knew. It was really scary for you all. Can you describe those days?
Yeah, well, there were a lot of uncertainties in the beginning, and it escalated quite quickly. So I think what we've perhaps forgotten is how over a period of days and weeks, it really ramped up, and suddenly the number of hospital admissions were huge. And I think we see that on the timeline that's very faithfully and accurately laid out in the programme. On the ground, we were kind of busy.
Yeah.
You know, we had a lot to contend with. And so I think at the time, there was a bit of a disconnect with what was maybe happening higher up and the advice that was coming through. We were, you know, most of us in the NHS were getting on with it, and it's only really with hindsight that we've seen there are maybe questions to ask about certain elements of the way things were handled.
The really scary area of the hospital depicted last night was the cold area, where patients are coming in, bit of a cough, not quite sure if they have it or not because testing was taking so long. That was the area you were in. At least in the hot area, you were dealing with the situation, but in that area, there were so many unknowns.
Yeah, it was managing the uncertainty that was difficult. You just didn't know who had COVID, who didn't. Originally, we thought they were just, you know, people who had the travel history, and then we were worried, actually, is this spreading throughout the community now? And it was a scary time for everyone, because we just didn't know. And as I say, with hindsight, you can look back and be like, well, it was obvious, but for us, we just had to get on with it and do the best we can under the circumstances that we had.
Well, you didn't know, and you literally had to make some really, really tough decisions, and that, you know, is the responsibility and the pressure of that I could not even begin to comprehend. And the numbers say it for themselves. A study conducted by the National Institute of Health found that post-pandemic, Nearly 60% of hospital staff had evidence of mental health disorders. Nearly 30% had evidence of PTSD, 27% of depression and 23% anxiety. Are you still feeling the effects of the whole pandemic, Tom?
Well, I think so. And making the programme, it's really interesting. We've both reflected on this, going back into PPE again with the masks and visors and things. It stimulated something that I guess I'd sort of buried quite deeply in terms of the smell and the texture of it and the feel, the claustrophobia of it. And I mean, I've been a doctor, I'm a bit older than Andrew, so I've been a doctor almost 20 years and I've seen some things in my time that I'll remember. But the concentration of cases in that period of time and those COVID cases that I still think about now was unprecedented. To see that sort of concentration of really sick people, some of whom sadly didn't survive. I think we're sitting on a bit of a ticking time bomb in the NHS with mental health in healthcare workers.
And how are you, Andrew? How are you from the effects of it all now?
Yeah, it was a very tough time. I remember when, and we'll probably get into this in a bit, but we did a bit of a boot camp for some of the actors and we were practicing with them, telling them how to put PPE on. And I remember when I was sort of showing them how to put on the PPE and the smell of the mask and the gown and things and that feeling of, it really brought back some memories which were not pleasant memories. And it's a constant process of dealing with things. I mean, the hospitals have never been busier and we're still seeing, for years to come, the after effects of COVID.
Joanne Froggatt by the way, Joanne Froggatt was so good last night depicting that, actually, when she put the mask on for the first time and the heavy breathing. And I think we can all relate to that a little bit when we first had to wear the masks. But the stress in her face, she was amazing, wasn't she, Annette?
She's incredible, and she has approached it with such kind of meticulous rigour. She asks so many questions. I mean, she never stops. She's just absolutely brilliant and really wanted, I think, to portray that as a doctor who's been doing it for years and years and years, and yeah, it's wonderful.
I just wanted to ask if there was any help out there for doctors, you know, that went through that time and, you know, wore that PPE equipment for those hours and hours on end. Is there any help out them for their PTSD and anxiety that they might be feeling? Yeah,
I mean, there are lots of kind of networks and things available, and I think we see later in the episodes, in episode 3, one of those sorts of groups where people are starting to come together, characters from the show, from the series, and talk about their feelings. There's probably not enough, and I think there's also, we battle against our inner need as medics and nurses and everyone else who works in healthcare to be a coper. Yeah. You know, and just to go, well, everybody's been through this experience. Why am I different?
I don't know how you do it. I really don't.
One of the big lessons from watching the drama, I think, would be listening to the people on the ground a lot more, because you guys, the doctors and the nurses, you spotted the problems before anyone else. It almost felt like there was an imbalance of where the information, where the guidance was coming from. Did you feel that?
Yeah, as I said, it can be difficult sometimes looking back on it and thinking, you know, there was obviously at the start we were all just trying to make do with what we had and the guidance that we had. But as we carried on, then we started to become a bit, particularly with some of the PPE downgrades and things, we were like, this doesn't seem right. You know, we have people who look very unwell, and you know, we're now managing with potentially plastic pinnies and gloves where we should have had the full PPE, but other members of the hospital were having access to this full PPE, and it became a little bit tricky, and we became a little bit cynical then of thinking this doesn't fit right with what we know and what our instincts are as medics.
We do have a reply from the DHSC. This is what they had to say. Throughout the pandemic, the government acted to save lives and livelihoods, prevent the NHS being overwhelmed and deliver a world-leading vaccine rollout, which protected millions of lives across the nation. We've always said there are lessons to be learned from the pandemic, and we are committed to learning from the Covid-19 inquiry's findings and will play a key role in the government's planning and preparations for the future. We'll consider all recommendations made to the department in full. And I know where those recommendations to come from. People on the ground, don't you think, Jess? Yeah.
Andrew, Tom, thank you. Thank you for everything you did during that time. And, yeah, just, I think, from us and the nation, like, we would have been totally lost without people like you.
And your colleagues.
Thank you very much.
And you have a starring role, I believe.
Well, a little role. Don't blink too
Which
many
episode?
times. But episode 1, playing Neil, who's one of the emergency department doctors.
There he
what
is.
do they go? There you go. Oh, I see you now.
Oh, there I am.
That makes sense.
And he's gone.
You played it perfectly.
So Breathtaking continues tonight and tomorrow at 9 p.m. on ITV1 and ITVX.
Thanks so much, guys.
Thank you.
For coming in.
Thank you.
Right.